everyone, welcome to my YouTube channel. Today we are going to learn about the cardiac cycle. Well, this is not the heart which we are going to learn about today, but this is the heart which we are going to learn about today. So the cardiac cycle is the most important topic in both NEET and also in MBBS. So let us learn the basic concept of cardiac cycle. This heart seems to be very much complicated, so I have made in a simple way for a better understanding. If you look at the basic concept of cardiac cycle, it is something like the two major veins which comes and drain into the right atrium, which is superior vena cava and inferior vena cava. Superior vena cava collects the blood from the head and neck, and inferior vena cava collects the blood from the lower part of the body. The blood gets drained into the right atrium. From the right atrium, through tricuspid valve, it enters into the right ventricle. From the right ventricle, it enters the pulmonary artery, from where it reaches the lungs for getting oxygenated. Let me tell you one thing, that right atrium and right ventricle contains deoxygenated blood which goes to the lungs to become oxygenated. The oxygenated blood finally reaches the left atrium through these pulmonary veins. Pulmonary veins are 4 in number. So these pulmonary veins passes the oxygenated blood into the right atrium. And from the right atrium, it goes into the left ventricle through bicuspid valve, which is also called as mitral valve. And from the left ventricle, it reaches the aorta through semilunar valves, which governs the opening of the aorta. From the aorta, it directly reaches into the systemic circulation of the body. This is the whole idea of cardiac cycle. So let me tell you few tricks to remember this valves present here. It is, the few tricks are, tricuspid valve is always present on right side and bicuspid on the left side. To remember this, right, R-I-G-H-T, right has more number of letters, hence it has more number of cusps. So let us remember this way, that right have tricuspid and left, which has less number of letters, has bicuspid valve. There are so many people I've seen who get confused between this tricuspid and bicuspid valve, and this is the trick to remember it. And let me tell you an interesting fact, that mitral, it is also called as mitral valve because it has two heads like this. Hence it is also called as mitral valve. And tricuspid valve have 3 heads just like this. It forms 3 bands or 3 cusps. Let's see the phases of cardiac cycle. In phases of cardiac cycles, we have atrial systole, atrial diastole, atrial systole, isovolumic contraction, ventricular ejection, isovolumic relaxation, and ventricular filling stage. For the undergraduation level, you can just remember it as atrial diastole, atrial systole, ventricular diastole, and ventricular systole. For further education, like in the sense MBBS and all, you have to remember all this. Just the basic understanding of systole and diastole is, systole means contraction and diastole is the relaxation, and whole cardiac cycle is just comes under this all these phases. Let us see the duration of cardiac cycle. We all know that the heart beats 72 times per minute. Hence, if the heart beats 72 times per minute in a person, then the duration of the cardiac cycle is 0.8 seconds. And these 0.8 seconds is divided into atrial systole, which is 0.7 seconds, atrial diastole 0.1 seconds, 0.7 seconds, and ventricular systole is 0.3 seconds, ventricular diastole is 0.5 seconds. This is a rough idea of cardiac cycle. So if we see in this diagram, we have all the same thing which I have already told you. This is a bicuspid valve which is present on the left side, tricuspid valve present on the right side. We have superior vena cava, inferior vena cava, which comes and drains into the right atrium. We have this arch of aorta, in which 3 main branches are very important, which is left subclavian artery, left common carotid, and right subclavian artery. And we also have pulmonary trunk, left atrium, the same thing which I have already explained it to you. Thank you so much for your patient listening, and I hope you understood the idea of cardiac cycle, and this would make you even more easy for you to understand the further topics inside the cardiac cycle.